Hello and welcome to another fantastic episode of Ask the Home Care Expert. This week's wonderful guest is Prima McGrew from Cavalier Healthcare Services. And how do you tell a little about yourself?
Hi, I'm Prima McGrew. I am the owner and administrator of Cavalier Healthcare Services. We are based in Northern Virginia. We cover whole Northern Virginia for home healthcare services. And I'm here with David to talk a little bit about what type of services we do and give a little distinction between home health care and home care.
Yeah, so we have 1,000 people on our Facebook pages, so participating, group pages, working with seniors, working with family members. That we kind of provide resources here, and there's a lot of questions out there. What is home care? What is home health? Home health actually has some different names. Skilled care is home health. Is can you explain what is home health or what is skilled care or what are some of the names out there?
Sure, you're exactly right. There are a few names. There's home health care. There's home health. There's home care. And usually I try to really make people understand that it is true. We're all working in the home to help the patient when you love one. Really get those services that you need from healthcare providers. The difference is home health care usually refers to your skilled professionals. We're talking about your licensed professionals that go into the home that usually are covered under your insurance, prescribed by a doctor, and providing services under their disciplines. The disciplines that we cover are physical therapy, occupational therapy, speech therapy, and skilled nursing. Again, that can be a gamut of diagnoses. You could be coming from the hospital, nursing home. Some people get doctor's orders straight from the doctor's office. But again, you need those skilled clinicians, licensed professionals to come in, work under a doctor's prescription for a certain amount of days, a certain amount of weeks, and those services can usually be covered by your insurance.
Okay, so a lot of people, you say it's home care, that what we do, the personal care, the private duty, the caregivers is non-medical. Skilled care is a lot of times medical care. So how does someone get it? Do you have to have a doctor's note? Or are there other ways to get these type of services?
I usually tell people there are three ways. Yes, you have to have a doctor's prescription. But I usually say there's three ways to get that. Sometimes the doctor isn't the one that maybe initiates the home health care. Sometimes that is your home care provider. You may have someone in the home caring for you, doing your laundry, helping you do exercises, helping you get better, and they may say you're getting a little more weak or you're not doing the stairs well. Let's go see your doctor and tell them what we see is going on and maybe get a prescription. So that may be initiated from your own family member or your care provider in the home to get you a prescription from your doctor. The second way is you fall, you go into the hospital, inevitably it happens. Something happens where you get admitted to a hospital or a nursing home and your social worker or discharge planner deems it necessary for you to have home health care. They think you need those services extended. Oftentimes you may start with therapy in the hospital or in the nursing home, and they feel that going home you will still need those services. So your discharge planner or social worker can initiate those services. The third way is your doctor. Your doctor looks at you, they take lab work, they prescribe you a new med, you have a wound or area that's not looking well, and they say, I really think that someone needs to come in and look at you and be an extension of your doctor's office. Maybe that's a skilled nurse, and that person can come in 2 or 3 times a week and look at your medications and look at your skin and make sure that things are going in the right direction.
So and you kind of hit on a good point. It's a couple days a week.
Yeah.
So can you home care, we can do 24 hours, we can do 8 hours a day, and we're doing private duty. and it's all paid by the family members.
Right.
So does a doctor write a prescription for a certain number of days or a certain number of weeks? How does that work? And does it have to be reevaluated at a certain period of time?
So all of our prescriptions, pretty much I would say, go in episodes. Your prescribing physician normally won't give an exact amount of visits or amount of days, but they will say evaluate and treat, because again, we have licensed professionals going in and making their best opinion. That physical therapist, that nurse, they're going into your home, they're going to use their medical license to decide how often they feel you should be seen. So again, it goes both ways. Sometimes the physician may say, I want to certify you for home health, but I want the clinician that goes in the home to decide the frequency. It can go the other direction. Sometimes we'll get an order and it'll say, I started a new med with this individual and I want a nurse 3 times the first week, 2 times the second week. I want some lab work done on the 3rd week, and then we'll see what the frequency may be. So again, I see both, but ultimately the doctor does have to sign off every 30 days on your prescription.
And then going into the home, so home care has usually CNAs or certified nursing aides going into the home, but you have LPNs, RNs. Who's going in? So, and then is there an evaluation ahead of time that's done by somebody completely different?
Yeah.
All right.
Yeah. So we use our licensed professionals are RNs, and so that RN can oversee LPNs. Oftentimes they do. But RNs will initiate the cases, and in our case, we use RNs most frequently because our patients, usually when they're needing skilled home healthcare services, they're needing that extra care, they're needing that expertise. Are you on a new med, and is that med working? Do we need to change your medications? Do we need to change your protocol for your wound care? And oftentimes we use those skilled RNs to be that person who is the liaison to your doctor and the eyes and the ears for your doctor to let them know, this is what I see and this is what I think is going on, and maybe suggest some changes. So that being said, we use RNs, physical therapists. We also use physical therapist assistants, occupational therapists, occupational therapy assistants, which are called CODAs. Sometimes you may hear that term. A lot of people don't know. And speech therapists, they don't have assistants, so it's always going to be a speech therapist. Okay.
And you kind of touched on earlier, but payment. Obviously, home care is all private pay, but skilled care is actually covered by insurances, right?
Yes.
And what about Medicaid, Medicare?
Yes.
Okay.
Yeah. So we are 100% covered by most insurances. Not only do we take Medicare and Medicaid, we take a various amount of commercial insurances as well. So our billing department is great. There are a lot of insurances in the Northern Virginia area. And there are a lot of them that we do take. We are preferred providers for a number of commercial insurances as well.
Okay. And so, if I'm at home and, I recently had hip surgery, but I went through rehab and, I'm done with my rehab, but I think I could probably use a little bit here and there, or maybe an old, football injury. And I played quarterback, for UCLA. Yeah. So, but, a lot of throwing on the arm, soreness, it's been a couple years since I played and had it looked at, but, I'd like to get some looked at, worked out. Can someone who's just having a little bit of issues contact you, or how does that work?
Sure.
Like, how does someone know if they should go to you or a hospital?
Well, we always tell people, if you feel you need to go to the hospital, you probably need to go to the hospital. But we can take you afterwards. 911 is always the answer. Unless you're already signed on with us. But if you feel you need to go to the hospital, go. But if we're talking about minor, we had a patient just yesterday, for example. He felt his wife was having back pain. He had been to the doctor. She got medications. He said, she's just really having trouble climbing the steps to go to bed at night. So in that case, he had already been to the doctor. We got prescriptions, the doctor said, maybe she should try some outpatient physical therapy. He said, she's not going to do that. She already can't get up the steps. She's already not going out the home. So why should I drag her out the house? It's cold, it's 3 days a week. She's not going to be able to do those 5 steps to get out the home right now. And he said, can we try some in-home therapy? So that's the key. The key to home health care is really being homebound and having difficulty getting out of the home, taxing effort to get out of the home, needing someone to be with you to get out of the home, needing constant assistance. Maybe you walk in the home with a cane or a wheelchair, a walker, but when you go out to the grocery store, you need that wheelchair. Those are indicators that you would need home health care.
Have you ever had someone who's refused care and, the doctor says you need, physical therapy in the home, maybe the family members on board, but the elderly person, the senior, either maybe demented, doesn't want to do it or doesn't think they think they're all healed up. How does your team deal with someone who's a little bit more difficult, as we like to say?
Yeah. We get difficult patients all the time. I laugh because I'm a physical therapist and I say pain and torture, like in the outpatient world, some people look at us and they're like, oh, we don't want to see you, you mean pain and torture, you're going to make me work. But our team really starts with the personality of the care provider, as you know as well. We screen our full-time team, and by that I mean we really find people who want to be a part of a team that with a good personality, that cares, that's committed. We have patients refuse us all the time, but it's the point of I want Prima or I want David to be in my home today. I want to welcome them into my surrounding and space, and sometimes it's just a mental feeling of having someone there. We're providing care to people, and we're providing a service to people. So a lot of people get attached to their therapists. Maybe they don't want to do the walking, around the block today, but they want that therapist to come in and really make sure they can get in and out the tub, or they can make it to the kitchen for their meals. So when we have people who refuse, we give them a day. The nice part is it's intermittent care. It doesn't have to be every day. Maybe you're not feeling well on a Tuesday, but you're going to do it on a Thursday, right? So oftentimes we can switch your times, we can switch your days, but usually we really don't have that problem because our team is really great.
Well, that's the one thing, we've worked closely with Prima and her team. Again, they're going to be in there a couple hours kind of doing the grunt work, and our team is able to just kind of make sure that afterwards that everything is safe, that we're not having falls or just kind of throughout the day or even throughout the night. So home health and home care work really well together. We've worked with several of their nursing staff, and they are absolutely amazing. But why don't you there's a lot of different companies out there. I want you to have the opportunity to talk about Cavalier specifically.
Yeah.
What makes them so great? Obviously, I know, but we have several guests out there today. And why don't you tell them, what's and what to look for. What to look for when you're thinking about going into it.
Right. I did home care. I come from a background. I got my doctorate in physical therapy, and I went into home care, and I have loved ones who've done home health care. And the number one thing that is important is your staff. We kind of talked about it before, but the person who's coming to your home. Home health care is not a setting where, like the hospital, you got to take who's on shift. Mary's on 9 a.m. to 9 p.m. You just got to take her. If this is your home, you're opening your door. You have the right to not open the door, right? So we start with people who just really have a great personality and really are committed to the patients that they're seeing in the home, and they respect your home. They respect your time, and they respect what you have going on. You're taxing effort to leave the home, or you're not feeling well. The second thing is full-time staff. You want to look for companies that really try to keep the same therapist seeing you, the same OT, your same PT, your same nurse will look at that wound. You really want staff that directs your care from you, their eyes, to the doctor's ears or eyes. And that can become really important in changing your medications and healing and doing things like that. And the third thing is just you want a company who specializes in what you need. So one of our biggest, proponents is that we specialize. We have care teams. We have a Parkinson's care team. We have a lymphedema care team. We have wound nurses. We have wound therapists, physical therapists. We have occupational therapists who are trained specifically to treat Parkinson's and do home adaptations. So that's really important for us because we have people who really are passionate, so passionate they went and paid even more money to get more degrees to do certain areas of care, and we really pride ourselves on those individuals going out and caring for the clients that need that.
I want you, we're going to tag Cavalier's Facebook and website in the comment sections. So you do have the opportunity to kind of look them up. But on the short term, what's the best way for someone to contact you if they have further questions?
Go to our website, CavalierHomeHealth.com. That's our website, and you can put in a referral. You can look up our specialties. The second way is just to call us. 703-647-3725. Just give us a call. We can answer any questions. We have a nurse on call 24 hours. They can answer any questions you have. They can help you facilitate getting a prescription or understanding what type of services you need.
Awesome. Great. Thank you so much. And thank you so much for being here.
Thank you.
I really appreciate it.
Yeah.
We do have some other great guests coming up down the line in December. We've got Vitas Hospice coming in. We've got Mobile Dental. So we're going to have some great, wonderful guests, just like Prima today.
Yeah.
So if you're watching today, if you really like the video, please click like. If you love the video, please share it with those that are, might find this beneficial. We're going to be posting this on YouTube, so if you're watching from YouTube or the HomeCare.com Facebook page, again, share it, like it, whatever to get the word out, because, the funny thing about the senior care industry is people don't know until they're actually involved, so kind of getting the word out early is always best. But I want to thank Prima again, the wonderful staff at Cavalier. We work closely with them, so I can really bring in the best for everyone to look for. So if you have a question, Prima will be answering it throughout the week. Otherwise, we will see you next Friday, we'll take off next Friday due to Thanksgiving, but the following Friday we will be back. I think it's December 1st. We will be back that Friday answering your questions. So again, from all of us at #AskHomeCare.com or #AskHomeCareExpert@HomeCare.com and Cavalier Home Health, thank you very much for watching today.
Thank you.
Bye.